the Uganda Medical Association, a body that unites all medical and health workers across the country, has called upon the Parliament to respect the presidential decision of enhancing the salaries of doctors and health workers across the country. Now, the call was made by Dr. Oledo Samuel Odong, the president of the association, while addressing the media in Kampala. Ahomuza has more.
In November last year, President Yoweri Kaguta Museveni directed that the monthly salary for doctors and medical workers, not forgetting the internees, be increased, and for intern doctors, the president ordered that be increased from 750,000 shillings to 2.5 million shillings. However, this was given a cold ear, forcing the doctors to go for an industrial action starting 1st May 2022. While addressing the media in Kampala, Dr. Oledo Samuel Odongo, the president of the Uganda Medical Association, a body that unites all doctors in the country, said they have resolved calling off the industrial action, thus calling upon the parliament to ensure the presidential directives are implemented.
I call upon the Speaker of Parliament, honestly. Cabinet has spoken. Can the members of Parliament implement this? You saw what happened in COVID-19. We have been struggling to bring doctors in the diaspora to come back so that you're not able to fly out of the country. The services you got to get out are brought closer here. The time you get an emergency and you come to a facility that has to save your life, and the people who are meant to save your life are not there, or are there, but because they save are not there, people will watch you die even if you're honorable member of Parliament.
He further said that they stand in solidarity with the allied professionals who of recent also demanded a salary increment, but advised them to negotiate with the government.
We are glad, by the way, allied health workers came out clearly to bring their issues. We are standing with them, and we are hoping government works on their issues and their issues are resolved. Because as doctors, we work with our colleagues in allied. So we encourage them also, as they choose to lay down tools, let's have a lot of dialogue with the government. Let this process end as fast as possible. We come back. You work with doctors and nurses in hospitals to save Ugandans at such a time when the economy is crashing. So we cannot use the predicament of Ugandans against our own interests. We can't use that. But we are hopeful that the issues are going to be resolved. So we call upon government, please, can you resolve these issues as fast as possible? Because we don't want the promises and the trust that you have with doctors to be taken for granted, that later you can cause us to actually cause for a mother of all mothers of industrial actions.
Dr. Odongo revealed that over 3,000 doctors in the diaspora have agreed to return home and invest in the country's health sector. It should be noted that for a long period of time, doctors and medical workers have been complaining over poor remunerations and lack of incentives across the various government facilities, saying it undermines their abilities to deliver services to Ugandans.